Hello and welcome. Today, we're diving into auditory neuropathy spectrum disorder, or ANSD. While it may sound like an ear problem, the effects can profoundly impact a child's development, particularly their vision and communication skills. This video will break down everything you need to know about ANSD, from its causes and symptoms to diagnosis and management. What exactly causes ANSD? The truth is, the exact etiology is often complex and multifaceted. ANSD isn't a single disease but rather a spectrum of conditions. Potential causes can include genetic factors, premature birth with complications like low birth weight and neonatal jaundice, auditory nerve damage due to infections such as mumps or measles during pregnancy, or even exposure to ototoxic medications, drugs that can harm the inner ear. Sometimes the cause remains unknown, and we classify it as idiopathic ANSD. Let's delve into the pathophysiology, or how ANSD affects the auditory system. In a healthy ear, sound waves travel to the inner ear where hair cells in the cochlea convert these vibrations into electrical signals. These signals then travel along the auditory nerve to the brain, where they are interpreted as sound. In ANSD, the cochlea typically functions normally, meaning it can detect sound. However, the problem lies in the transmission of these signals. Either the inner hair cells are not properly communicating with the auditory nerve, or the auditory nerve itself is malfunctioning, preventing a clear, synchronized signal from reaching the brain. This disrupted signal results in distorted or absent sound perception, even when sounds are loud enough to be heard. While comprehensive global statistics are limited, studies suggest ANSD affects approximately 1 in 10,000 births. It's estimated that ANSD accounts for a significant percentage, around 10–15%, of all cases of hearing loss identified in newborns. It's important to note that these numbers can vary depending on geographic location, screening practices, and diagnostic criteria used. Furthermore, some populations may be at a higher risk, such as those with a family history of hearing loss or a history of premature birth. The signs and symptoms of ANSD can vary significantly from person to person, reflecting the spectrum nature of the disorder. Common indicators include difficulty understanding speech, especially in noisy environments. Individuals with ANSD may struggle to localize sounds, meaning they can't easily tell where a sound is coming from. Their hearing can fluctuate, sometimes seeming better than others. Notably, infants with ANSD may not startle to loud noises, despite passing newborn hearing screenings. This discrepancy often leads to delayed diagnosis. Because hearing is crucial for language development, children with ANSD often experience delays in speech and language acquisition, indirectly affecting their visual and social development due to communication barriers. Diagnosis of ANSD typically involves a battery of audiological tests. The cornerstone of diagnosis is often the presence of otoacoustic emissions, OAS, sounds produced by the inner ear's hair cells in response to stimulation coupled with abnormal or absent auditory brainstem responses, ABR. OAs indicate that the cochlea is functioning, while the ABR measures the electrical activity along the auditory pathway. If OAs are present and ABRs are absent or abnormal, it strongly suggests ANSD. Other tests that may be used include cochlear microphonics and behavioral audiometry, where the child's responses to different sounds are observed. While ANSD isn't typically broken down into distinct types, it's often classified based on the suspected location of the dysfunction along the auditory pathway. Some cases may involve primarily inner hair cell dysfunction, while others may involve problems with the auditory nerve itself, or even issues at the synapse between them. Knowing the probable site of the lesion can guide treatment strategies, but doesn't necessarily define separate types of ANSD in the traditional sense. Currently, there's no cure for ANSD, but various treatment and management strategies can help individuals maximize their hearing potential and improve their communication skills. These include hearing aids, which amplify sound, although their effectiveness varies depending on the severity of the nerve damage. Cochlear implants, which bypass the damaged parts of the auditory system and directly stimulate the auditory nerve, can be highly effective for many individuals with ANSD. Speech therapy is essential to help children develop language skills. Additionally, visual cues like sign language and lip reading can be incredibly valuable communication tools. A multidisciplinary approach involving audiologists, speech therapists, educators, and parents is crucial for successful management. Unfortunately, there's no known way to directly prevent ANSD in most cases, especially when it stems from genetic factors. However, certain preventative measures can risk in some situations. Ensuring pregnant women receive proper prenatal care, including vaccinations and avoiding ototoxic medications, can help. Preventing premature birth and managing neonatal jaundice can also lower the risk. Genetic counseling can be beneficial for families with a history of hearing loss. The prognosis for individuals with ANSD varies greatly. Some may experience significant improved aids or cochlear implants and develop near normal language skills. Others may have more limited success, requiring a greater reliance on visual communication strategies. Early diagnosis and intervention are critical for maximizing a child's potential. Recent research is focused on understanding the genetic basis of ANSD, developing more targeted therapies, and improving the outcomes of cochlear implantation. Studies are also exploring the use of auditory training programs to enhance speech perception abilities. While challenges remain, ongoing research offers hope for improved treatments and outcomes for individuals with ANSD in the future.